So as I told you, we have celebrated World Oral Health Day on 20th March. So basically, World Oral Health Day aims to empower people with the knowledge, tools, and confidence to secure good oral health. This is a very basic definition from WHO for health. It is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. So this is a very basic. I think when you read about your community medicine, this will come again and again, and they will ask you the same thing. Same, according to WHO, for oral health, it is defined as state of being free of mouth and facial pain, oral infections and other diseases that limit an individual's capacity in biting, chewing, smiling, speaking, and psychosocial well-being. It is a key indicator of overall health. As I told you, the systemic health and oral health are interrelated. To maintain good oral health, oral hygiene is important. What is that? It is the maintenance of oral cleanliness for the preservation of oral health, whereby microbial plaque is a soft debris, okay, is removed and prevented from accumulating on teeth and gingiva, that is gum. Why do we need oral hygiene? See, according to the statistics, worldwide 60 to 90% of children and closely 100% of adults, they have dental cavities. 15 to 20% of middle-aged people, they have severe periodontal disease resulting in tooth loss. Periodontal disease, in a layman term, it is pyorrhea, what you might have heard. And then 30% of geriatric population, they globally have no natural teeth. So if you see this, you see the statistics, that's why oral health is important. To maintain good oral health, we need plaque control. As I told you, plaque is what? It is a soft debris deposited on the tooth or teeth or gingiva. So removal of microbial plaque on regular basis and prevention of its accumulation on teeth and adjacent gingival surfaces. So it is must. If you are doing this, it is more than enough. And what is the rationale behind that? If you are removing plaque regularly, there is no accumulation of supra and subgingival plaque. It means there will be no bacterial colonization and there will be no tissue destruction, that is gingiva, either it is soft tissue or hard tissue. So by regularly removing plaque, you are controlling periodontal disease, and as I told you, they have interrelationship. So if you are controlling periodontal disease, anyway somehow you are guiding systemic disease also. Why? Because periodontal health affects overall health. So through our text, what it says, diabetes mellitus and smoking, these are the established risk factors for periodontal disease. See, periodontal disease, you can take it as it is a form of pyorrhea only. Okay, there are different types of periodontal disease, and pyorrhea is a very common layman term to understand that. And some common associated medical conditions are diabetes, cardiovascular disease, respiratory disease, and preterm low birth infants. This is the picture depicting the interrelationship. You can see various systems are affected because of oral health, compromise oral health. To control plaque, basically plaque control needs two basic things, that is mechanical plaque control and chemical. Mechanical, it involves what? Toothbrushes and other interdental aids, and chemical is various mouth rinses, toothpaste and gel, sprays, all those things. So coming to the mechanical part, if we go back, initially chewing twigs and miswak from medicinal plants, they were used. Chinese invented the modern toothbrush in 1600, and William Addis was the person who designed a toothbrush with bone handle and hog bristles in 1780. Plastic brushes with bone handles were introduced in 1900, and during the World War II, that is 1939 to 45, nylon bristles, which are quite superior than natural bristles, were introduced. These are some basic shape and sizes of the toothbrush which were available during 17th and 18th century. The design of the modern conventional toothbrush, that is manual toothbrush, can be attributed to Dr. Robert Hudson, a Californian periodontist in USA in early 1950s. See, this is the basic design of a toothbrush. You can compare it with any basic instrument also, that manual instrument, what I meant to say, it has handle, shank and a working end which is head. Head has toe and heel. So these are some various your designs, maybe with a straight shank or a angulated shank, your shank. So this is according to the convenience we usually use and prescribe. Now, according to the American Dental Association specification of a toothbrush, this is ideal. Usually they follow because then only it is recommended and it comes commercially in the market. Length should be 25.4 to 31.8 millimeter. Width should be 7.9 to 9.5, and these are 2 to 4 number of rows, and each row should have 5 to 12 tufts that you can see, and bristles are 80 to 85 bristles per tuft. That is what I am showing is it is the head part of toothbrush. But for all this, to maintain proper oral hygiene practice or proper oral hygiene, you need basic two things, that is technique and tools. Technique is more subjective, that is the brushing technique. So there can be limited modification, but tools are objective like toothbrushes, interdental aids. They can be structured, customized and controlled. So this will be only successful when performance becomes practice. It's not only just you are guiding somebody or just you are prescribing. You have to motivate them also. Determinants for the brushing performance are, these are some of the basic things. I think your friends or your family members, they will ask you. Frequency, force, duration and method. Mainly is for you all it is frequency and duration. This is related to toothbrushing I am talking about. So coming to frequency, quality of brushing is likely a more important factor than the frequency. Previous workshops, like different workshops and through different studies, they have identified a brushing frequency up to 2 times a day. So it is quite ideal. Why? Because there is no significant gains to be achieved by increasing this frequency. Means they have compared, they came across, if you do 3 times a day, 5 times a day or 10 times a day, it will not improve as compared to twice a day. Okay. So it is ideally, you can't say there is a substantial evidence and this is a sort of a hallmark or gold standard, but twice a day is ideal. Coming to force, we usually say gentle force. You should do lightly or gentle force you should apply, but it is still not defined clearly enough to be used in clinical situations. But through different studies they came across the range should be 2.3 to 3 Newton. That is your brushing force I am talking about. Coming to duration, one of the critical factors affecting the efficacy of toothbrushing. Main cause of insufficient oral hygiene in general population is too short a brushing time. Hardly 5-10 seconds, it is over. It is more of psychological. Brushing is over. I have rinsed also, it's fine. But actually it is not. Commonly recommended toothbrushing time is, like it is through various studies they have came across, 120 to 180 seconds means 2 to 3 minutes. These are some popular and basic techniques which should be applied. I think for you, the name is not so important, yeah, but if you can remember it is fine. Bath method, it is usually prescribed for any of the normal patients, either they have periodontal disease or they don't have. Modified Stillman, basically wherever there is a gingival recession means gums are going down and there is a root exposure. And Charter's method, more of it is after periodontal surgeries or gum surgeries when we prescribe this in a healing area, and also when somebody is undertaking orthodontic treatment. But ideal, the proper brushing method is important. Why? Because faulty toothbrushing may affect both living objects and non-living objects. The picture shows the result. It looks like the picture is from Battle of Panipat. The other form is electric toothbrush, commonly power toothbrush. You will ask, you will go to the chemist shop, they will say this, they are electric one which has 10. So these are power toothbrushes invented in 1939. Basic mechanism is mechanical contact between the bristles. Bristles, I think you know, just now I show you the diagram. So common contact between the bristles and the tooth to remove plaque biofilm, plaque stain, soft debris. The vibrations have also been shown to interfere with bacterial adherence to the oral surface. So basically they are inhibiting the adherence, and hydrodynamic shear forces created disrupt the biofilm, that is same is plaque only at a shorter distance from the bristle tip, explaining the additional interproximal biofilm removal. Interproximal is it is the space between two adjacent teeth. That is called interproximal term is used, or you can say interproximal spaces between two adjacent teeth. These are some other brushes. Ionic toothbrushes. Basically, they have a mechanism of iontophoresis in hypersensitivity cases. Like whenever you have like sort of a severe hypersensitivity, or chewable toothbrushes, they are flavored plastic toothbrushes. But till now, there is no substantial evidence which says that your power toothbrushes are better than manual toothbrush. There are various studies they have done, but there is no what the clinical evidence still it is not there. So basically, when you are prescribing ethically and as a professional, you should always see morphology of the dentition, dexterity of the patient, and periodontal health. So according to the indication, seeing the patient, you have to prescribe the same, because you can't say, yeah, it is expensive, that's why, and plus it is very superior to manual toothbrush, that's why I am writing to you. It's not like this. Yeah, there are some advantages, but it's not like, as I told you, there is no clinical evidence, no established clinical evidence which shows that power toothbrushes are better than manual toothbrushes. See, any toothbrush, regardless of brushing method, does not completely remove interproximal plaque, same, the interproximal space. So those spaces are what? They are inaccessible sometimes with your regular toothbrushing. So in such conditions, you require some interdental aid. What all? Commonly are dental floss and your interdental brushes or proxa brushes. So dental floss is most widely recommended for removing plaque in interproximal areas. It can be made easier because now the flossing is available with the floss holder, so it's quite convenient and it is patient friendly. Interdental brushes or proxa brushes, these are conical shaped brushes made of bristles mounted on a handle, can be unitufted or multi-tufted. So this what I was telling you, interproximal spaces, the space between two adjacent teeth. So see this picture A, B and C. In A, you can see there is no recession of papilla, means it has not gone up if you see this picture. So side contact is there, there is no recession of papilla. So there you have to prescribe dental floss, as I have told you. And the picture B, there is mild to moderate what loss of papilla. Okay, so there multi-tufted proxa brushes. You can see multi-tufts are there in that brush. So there you have to prescribe multi-tufted. Okay, and the last is there is complete loss of papilla. It has almost gone up. There unitufted or single tufted proxa brushes are used. Coming down to the second picture, that is more of, you can see the cleaning of concave or irregular proximal tooth surface are difficult. So sometimes if you are using floss, again it is not, the debris is not removed, the plaque is not removed properly. There again multi-tufted brushes are prescribed as compared to floss. So this is the one more thing. Toothpicks, I think you all know, they are triangular in shape, made of wood or plastic, are available with or without handles. But again I will tell you, this is an emergency tool. It is never recommended for regular use. I think more often you know either in restaurants or maybe you have in your homes also, but it is never recommended every day you should use this, because it may lead to tissue trauma, sort of a laceration in soft tissue. Tongue cleaner, they are also very important in removing. Why? Because they remove what? Volatile sulfur compounds which are there on the dorsum of the tongue, and they are related to what? Halitosis or bad breath. So that's why either conventional tongue cleaner or power tongue cleaner are recommended. Coming to chemical plaque control, the mechanical part that included your toothbrush, your power brushes, your interdental brushes, I think at least some basic idea you know about. And as compared to that, chemical plaque control is also important, but again, it it is an adjunctive, not a replacement. So always remember, mechanical plaque control is ideal, but sometimes if required, we always prescribe chemical plaque control also, but it is used always as an adjunctive, means in addition, not a replacement. You use only mouth rinses, you apply gel, there is no need of brushing. Ideally, it is not there. If somebody is saying clinical evidence is not there, okay, so always mechanical plaque control should be followed by chemical if required, that is as an adjunctive. These are some of the vehicles used: mouth rinses, sprays, gel, toothpaste, chewing gum, and varnishes. Fluorexine has been regarded as a gold standard in dentistry for the prevention of plaque and gingivitis because of its basic mechanism and properties. It has an anti-plaque property and antibacterial activity. Okay, so it is more of, it is bacteriostatic at low concentration and bactericidal at higher concentration. So it is quite important, very commonly prescribed, has hundred of uses, but some important are as an adjunct to mechanical plaque control, as I told you. For handicapped and medically compromised patients, it is prescribed as an endodontic irrigant. Like you might have heard when we are doing root canal treatment, it is quite important as a prophylactic rinses, and also in dental unit water lines as an antibacterial. These are some of the common side effects: staining, face ulceration, increased calculus formation also, oral mucosal lesion, and sometimes unilateral or bilateral parotid swelling. But these are not very common, but yeah, especially staining and taste alteration is quite common. Dentrifices are also part of that. You all know, I think by seeing the picture, you must be remembering. Is a substance used with a toothbrush for the purpose of cleaning the accessible surface of teeth. It dates back over 2000 years back. Dr. Washington Wentworth invented a toothpaste tube in 1892. In 1942, Baby conducted the first clinical trial of a fluoride toothpaste. These are some advancements. Oral irrigation devices are available nowadays. It is like, it includes the use of water picks, useful in elimination of plaque and debris from periodontal sockets. So basically, they work on the mechanism of pressure and pulsation, but they will never remove calculus. Like, I think you, during your, you might be seeing the advertisement on TV, the tartar removal is there, you use this paste. So that tartar is sort of what? It is a dental calculus, a hard deposit. All these things will never remove those. It is by what? Tartar. If tartar formation is there, it is a hard deposit. You have to go for professional cleaning, that is scaling and root cleaning. This is disclosing agent. These are also quite important. Contains a dye or other coloring substance available in solution, tablets or lozenges, used to visualize and identify dental biofilm on the surface of the teeth. It is more of a dental practitioner, but for your knowledge I am telling you, and it is an important motivational tool for a patient. You can show them, see, after 6 months you have come and see how much of plaque is there. By this solution or by using these tablets, you can show them. So it is sort of a motivational tool. Yeah, the doctor has told me so and so instructions, and in 6 months also I have not followed those. That's why it has come. Okay, so like this, it is a good and an important motivational tool. So I will conclude by saying that the foundation of any health intervention, including oral hygiene instruction, should be firmly based on scientific evidence and not on tradition alone. Two imperative components which should be recognized are the risk and the motivation of the patient and their community. And we all know good oral health begins at home. So always encourage better oral health care. Why? Because good oral health is directly proportional to healthy aging. And as you know, these days one common term is there, takeaway, sort of a takeaway. So from this, I think a small talk, the takeaway message for you all is always remember rule of two. Rule of two is what? In my previous slides only I have discussed. It is what? 2 minutes of brushing. I told you 120 to 180 seconds means 2 to 3 minutes. So 2 minutes of brushing, twice a day brushing, and twice in a year visit to dentist. That is every 6 months. So it is very easy to remember. So in a nutshell, within these 50 slides is rule of 2. Thank you for your patience. Yes. Now I'll call one of my colleagues, Dr. Siddharth. He is from Department of Orthodontics. Briefly, within 10 minutes only, he will tell you the most popular treatment, braces, in a layman term. It is orthodontic therapy or orthodontic treatment. I forgot to introduce myself. I am Dr. Ashish from Department of Gerontology. So anything related to gum diseases, straightforward you can come to dental college, and accordingly any problem you have, they will guide you, and we are there to guide you. But at least this is for you, for your family, and for your patient in your coming years. Okay, thank you.